I'm Kristine Sorensen. We know that older people are the hardest hit by this pandemic, but it's not just the disease itself, it's the loneliness brought on by the isolation. I talked with an expert who says this loneliness is a second epidemic.
We have totally forgotten what this does to people emotionally and with depression and loneliness and how it affects them and their families.
Jeff Weinberg is a licensed nursing home administrator and a patient advocate in Pittsburgh. His own mother-in-law died in a nursing home just last month after thriving up until the pandemic forced her into isolation.
When March 13th hit, which was Friday the 13th, that was the last day my wife saw her mother. And she kissed her goodbye. And as she was leaving, she was told that she can no longer visit.
Most people in assisted living facilities have been isolated since the pandemic struck, not only from visitors, but from each other. No meals or activities together. The only interaction is with caregivers who are practically unrecognizable in their masks and gowns.
It sounds like solitary confinement to me.
It's very close to it.
A study from Brigham Young University shows loneliness is associated with an increased risk of early death by 26%, social isolation by 29%, and living alone by 32%. Overall, this means loneliness can be as bad for your health as obesity.
I think people just decide to give up. And then as a result of that, they don't have the motivation to look forward to the next day.
Weinberg suggests that assisted living facilities make an extra effort to help families visit with their loved ones in outside areas from a safe distance, because the mental health of patients can be as important as the physical health. You can see my full interview on how loneliness is a second epidemic on CBSN Pittsburgh tonight at 8. I'm Kristine Sorensen, KDKA News.